Nobel Prize for Immune System, regulatory T cells. Regulatory T cells are responsible for regulating the immune system. Regulatory T cells ensure the regulation of the immune system. What truly matters is that the immune system is regulated. Many people equate an increase in inflammation with a strong immune system. However, that's not the case. When the immune system is strong, the formation of inflammation is kept at a limited level. If we consider the healing process of a wound or an injury, it is contained locally and does not spread. But if it is weak due to hopelessness, an excessive cytokine response can occur that affects all organs. As with COVID-19, while some people only experienced it like the flu or a cold, many others lost their lives with pneumonia, even more severe conditions, SIRS, ARDS, and respiratory failure. The problem with these cases was that most of them had chronic diseases, obesity, or diabetes. Because of this, there was an inflammatory event in the body. In other words, the immune system was already weak. And because of this, COVID-19 progressed severely in this group of patients. If we return to our topic, as you can see on the screen, the first person to conduct the study in the 1980s, Shimon Sakaguchi, a Japanese scientist, was the first to detect regular T cells in the periphery. He realized that the regulatory system of the thymus was functioning with a certain mechanism and pursued this further. After that, he was the first to define these T cells. The person who truly deserves credit is Mr. Sakaguchi. Later, the Swedish scientist Mary Bronkow and the American Fred Ramstein FOXP3 contributed to the literature by observing and identifying that the transcription factor FOXP3 plays a role in the immune regulation system, that it is a transcription factor present in these regulatory T cells, and that mutations in this factor lead to the development of such immune diseases and inflammation. Because of this, both of them were awarded the Nobel Prize. Now, let's get to our topic. During the COVID-19 pandemic, I also focused on this subject, and in the article I wrote, I associated this system, the immune regulation system, with retrograde signaling disorder, and in this way I described COVID pathogenesis as a form of immune dysregulation, thus contributing to the literature in this manner. Essentially, the pathogenesis of COVID is a retrograde signaling disorder. We stated that it is a disorder of retrograde signaling and immune dysregulation, in other words, a system regulation disorder, and this was published, received numerous citations, and continues to be cited. We put a lot of effort into creating this figure at that time, as you can see here. As shown, derivatives of vitamin A, which could be vitamin D, other essential fatty acids, vitamin E, or herbal and spirit compounds are involved. As seen here, the naive cells, which are stem cells, are depicted. SSO also plays a role in the transformation of regular T cells. There needs to be a certain level of this in the blood, of atran and other essential fatty acids. When these are at the right levels, the body does not take a stance in favor of inflammation. Regular T cells are formed. What do T cells do? They provide immune tolerance and self-tolerance in the body, and it strongly suppresses inflammation. But when these compounds are low inside the cell, stem cells evolve into inflammatory T cells, leading to inflammation in the body, which can then progress to multiple organ damage and severe clinical conditions. In this way, we have also made a contribution. Once again, thank you in this regard. I wish you healthy days.